Welcome to our lecture this week, September 17th. What is your pharmacy business? We have discussed in prior lectures about what is an entrepreneur, what are the top mistakes that make an entrepreneur, and we also discussed one of the key components to having your own business, operation management. But in this lecture, we want to explore what is your pharmacy business. In the last week, I've read your first reflection paper of what you hope to get out of this course and what has intrigued you thinking that you may want to own your own business and be your own boss. So what we're going to discuss today is taking a look at how do you start thinking about what is the type of pharmacy business that I would like to have someday in the future, and what does it take to start to develop your own business. So the first thing I want to stress is that when it comes to a pharmacy business, and one of the requirements of the second course of this semester, of next semester, is that you will develop your own pharmacy business plan, is that it doesn't necessarily have to be a store. Your pharmacy business can be something that you think is going to be both beneficial to patients, consumers, customers, and patients, and the business is a reflection of what you have worked so hard these last couple years to become, is a pharmacist. So yes, traditionally we will talk this semester about a lot of the key components it takes to own your own traditional pharmacy, but a lot of the components that we're going to talk about, just like the prior lecture on operation management, can be applicable to other types of businesses. So we're going to begin this talk thinking about what are the opportunities that exist in today's pharmacy world. And we've already analyzed in our prior lecture about operations, but throughout this semester we're going to talk about some of the organizational behaviors you need to start thinking about in wanting to start your own business. So when you're developing a business plan, your business plan is designed in wanting to become your own owner, is to try to get funding either from a bank or an investor to want to buy into why your business should exist. Unless you're extremely wealthy, that, in order to start your own business, you will have to have some of your own money for either collateral or to put into the business, but you're going to have to seek funding to initially get started. And that is the way most businesses start. But a business starts with an idea. And from that idea, we then have to think about the legal structure. What does your business tend to deliver in terms of products and service? Where do you hope your business to be located? And what is the organizational structure that you hope to see in your business? And we talked about some of these things from an organizational structure standpoint in our operations management lecture. So what type of pharmacy business do you see that you want? When we meet as a group and we talk individually, I'm going to challenge you to think about, yes, you may want to have a traditional pharmacy business. And yes, even with all the challenges of the day, you still can be successful. But successful businesses are those that change with the times, look ahead of what's going to be needed for that area of business. And that is how businesses have been successful. Successful community pharmacy businesses, for example, have been successful because they've been able to evolve. They've looked at new opportunities, whether it's in compounding, MTM, immunization, long-term care, nutritional management. All of those have come into play. But what type of pharmacy business do you see? It could be in the community. It could be in an institutional setting, not necessarily a hospital setting, but it could be in home health. It could be in long-term care. You could be a consultant helping people develop their own businesses, people prepare for their own types of careers. Your business idea could be technology. One of our business plans over the years, we've had several different technology ideas that people have wanted to develop and see if they can develop a business based on that model. So there are different types of pharmacy business models that exist today. Traditionally, when you first start pharmacy school or you go to get your first intern job, you're exposed to the traditional ones, such as hospital or community pharmacy. But there are so many other entities out there: specialty pharmacy, long-term care pharmacy, nutritional support, different types of clinical enhanced services that exist throughout our country. But the biggest question is, you come up with the idea, but then you have to say to yourself, how does this idea make money? How does it support what I hope to do, to be able to draw a salary, pay other employees, and to continue to grow? And so we are going to, in the coming weeks, talk about what is your niche, what is your uniqueness to your business. And as we go through exploring the financial side, we're going to think about, how can my pharmacy actually make money doing what I do? There's many different examples out there, and this is just an extrapolation from an article several years ago from the Pharmacy Times, looking at different types of pharmacy entrepreneurs. There are those who have seeked out taking advantage of medication therapy management to develop private businesses that either partner directly with PBMs needing to get Medicare Part D MTMs completed, looking to partner with other health systems wanting an MTM type of model, or partnering with community pharmacies themselves who are not been able to actually do their own MTMs. There are some companies out there that have created online forums for pharmacists to meet. One of the software companies that are out there is called Doximity, that actually has developed almost like a social network for pharmacists to share ideas. How does that business make money? A lot of it is by advertising and more enhanced membership. There have been also successful nonprofit organizations out there across the country that have developed MTM vaccine services for homebound seniors. There are pharmacists who have developed educational services to help people prepare for board certification. Some type of pharmacy businesses have been able to get into writing, providing writing for pharmaceutical companies, national magazines to educate pharmacists. And there are several that have gone into the podcasting business, online audio-based consumer medication information. And the way they make money is through advertising and also online membership. So there's many different ways. And you want to start thinking about your startup ideas. Your startup idea could also still be a traditional community pharmacy that branches off and has several other niches that enhance the current pharmacy distribution service. But as with every type of business you develop, you'll have to look at your opportunities, but you have to look at your threats. Threats are, we have other big players in the market. Amazon recently acquired the adherence packaging company PillPack. And we're not really sure what Amazon's idea of what they want to do with this. If you study the history of Amazon, they once bought an online pharmacy from one of the larger chains, and that kind of just flopped. Amazon just this past year, along with Berkshire Hathaway, announced that they were going to be starting their own type of health plan for their employees. And I apologize, the additional company that was going to be involved in that is JP Morgan Chase. We also have this new possible approval of vertical integration, where either the health plan is buying the PBM or the PBM is buying the health plan. And we see this with CVS Health wanting to acquire Aetna, and we see Cigna wanting to acquire Express Scripts. So how does this change the landscape in the business that you're looking? But with every challenge, there is opportunity. The challenges that we're facing in pharmacy are way beyond than just the mergers of large corporations. That we have a crisis at hand of drug affordability. And that has been stemmed by the differences of consolidation of generic companies, the acquisition of companies just buying old generic drugs and jacking up the price. Drug affordability has occurred because our healthcare coverage has changed, where we have more higher deductibles for patients. But where there's opportunity for drug affordability is the need for pharmacy experts to provide consults to advise patients what are the right drugs and how can they afford the right drugs for the conditions they need to treat. We all know that we have an opioid crisis at hand. How can your pharmacy business may be able to help solve that opioid crisis? We know that we have a large non-adherence problem in our country, and we know that the majority of our key chronic diseases, such as congestive heart failure, COPD, hypertension, diabetes, needs to be managed by medications to prevent high healthcare costs in hospitalizations and ER visits. But what uniqueness can non-adherence? There are numerous companies that are out there trying to develop this, hence Amazon buying PillPack, but there's still room. Nobody has found the magic key to solve this. And so although there may be many players in the game, there's nobody with a single right answer. Another challenge is that we want to develop these enhanced services. We know that we can be successful. Numerous studies have shown that. But we have challenges on how can we be compensated for this. We see the rise of pharmacy clinical networks, both national and state level. We see the still push for provider status, and sometimes things that can be successful to help our businesses have to come from the political legislative sector of our country. The traditional community pharmacy is challenged every day by the reimbursement squeezes from PBMs, the DIR fees that are associated with Medicare D. And we'll go more into this when we talk about third-party insurances later on this semester. Pharmacies are also challenged that they need to develop ways to get contracting to be in preferred networks, and sometimes pharmacies might be excluded. So having the skills of how do I network and get into these contracts is necessary. How do I get into the political realm? And this is not a political realm whether it's, a certain party that you need to abide, Republican or Democrat. It is about how can I, leverage my company the best it can to, gain advantage from a political side. We also need better technician training if we're going to try to develop new type of business models that have enhanced services. There might be companies that just evolve on being able to provide that training for a small business that can't afford to do it on their own. We still have problems with medication dispensing errors, adherence errors, so there's also opportunities with technology, whether in software or device development. And constantly we need to be paying attention to the different government regulations and healthcare reform. And those regulations which are now weighing on our medical benefits side with physician practices, healthcare systems needing to meet quality measures to improve payment, there's opportunities for pharmacy businesses that can help solve that problem from adherence and, clinical pharmacy services. So, think to yourself these reflective questions. What opportunities exist for the future of community pharmacy type of business or any type of pharmacy type of business? What do you think are the barriers to the future of a pharmacy in the community as a business? And start thinking to yourself, just start jotting down ideas on paper. What is some initiatives to develop a new revolution in a pharmacy business? We always need to think to ourselves, How would you approach the trends shaping the future of pharmacy? Instead of seeing that glass half empty, looking at it as an opportunity to fill that glass even more. How can we meet the needs of our patients, our customers, who may not just be patients, it may be other healthcare providers, other pharmacies? What are the trends to do that? And we've highlighted several of those at the beginning of this talk. Additional trends. There is a rising cost of healthcare in general, not just in drugs. And how can pharmacy businesses help solve this problem? We also know that, the script volume is not going to go away. There's always going to be a need for the distribution side of pharmacy. How can we make this more efficient, faster, safer to meet the needs of the public and the businesses that deliver it, whether it's through robotics, unique business workflows, unique software? Up for the next, at least 10 to 15 years, we have the graying of America. We still have the baby boomers to take care of. And as they age and their life expectancy increases, how are their pharmacy needs going to be met? There's the cost containment through managed care, and still ties into the rising cost of healthcare. There's still the threat of the growth of mail order. And how can you be unique enough to show that you are more in value than a mail order company? How do we partner with our government in services such as Medicare and Medicaid? Where is the need for the pharmacist in the community? And also you can see where is the new unique needs for the pharmacist in the institutional setting? What different types of business can arise that help improve drug safety, self-care, and our melting pot diverse population? Whatever business you want, you always want to think about what does the customer want and what is your expertise to deliver that. However, sometimes you need to think about what does the customer doesn't even realize that they need. In any business, you want to start low and go slow. You want to be focused, and we will talk about, and that is why we do a business plan on what is our niches and how we plan those niches to make a successful business, both profitably and, satisfaction-wise. Sometimes we need to study the businesses that have struggled. Anybody remember Circuit City? A very similar replica to Best Buy. Just a few years ago, Best Buy was on the verge of being non-existent, being pressured by, and still pressured by, the online companies such as Amazon. They've since restructured themselves, re-outlined of how they do. Who can remember carrying a BlackBerry? A company that had a great product but didn't do well enough in software development and also looking at new design development. Who would want to tap on a screen versus physical buttons? Hence, BlackBerry has gone into the abyss. You can study the many lies of Apple, although now, just recently it's been announced it's $1 trillion company. There was once a time in the 90s owning an Apple product was, cinnamon to owning junk. Microsoft has gone through many different realms. Microsoft has now diversified itself not only just in software, but in hardware. And Microsoft has also developed that is not just for Windows, but is unilaterally across all type of devices, from, Apple products to Android products to tablets to phones. And although these are tech companies that I mentioned, how does pharmacy re-establish itself? How do we change the public's perception of what pharmacy is, what other people view us as, and what can make your niche be unique to make that change? So let us talk. We talked about the idea part, and in the next couple lectures, we're going to talk about niching and developing ideas. But let's talk about some key components that need to be considered of whatever business model you're going to develop. You're going to hear me say this numerous times, but the two most important people that you're going to hire for the beginning of your company and the continuing existence of your company is a good CPA, certified public accountant, and a good lawyer. Because those people are going to help you with the financial planning and development of your business and making sure that you don't run into speed bumps of where you're paying more, especially when you're setting up your legal structure, which can have an impact on your liability, how you can obtain funding, and also how you are taxed. So there's different things that you may need to acquire. Obviously, if we think of a traditional community pharmacy, there's many licenses. We need to get approved by the Board of Pharmacy. And you need to, depending upon what state you locate, understand the rules of each pharmacy act. Currently, right now, here in Pennsylvania, our Board of Pharmacy really has most of the rules reflect physical brick and mortar pharmacies. They've addressed some issues like central pharmacies, collaborative practice agreements, and immunizations, but there's still less room of interpretation when it comes to consulting clinical service type of pharmacies. You need to seek, insurance, not, sometimes your traditional such as fire, theft, but also your liability. Because not only do we have liability when we are filling a prescription by the risk of making a med error, but we have liability when we're making clinical recommendations and consults that can have an impact on the outcome of the patient. Our business is highly regulated. We have HIPAA, we have OSHA, we have Medicare accreditation, and so a lot of those things have to be looked at both legally and financially. So, before you start setting up your business, the biggest thing you need to do is research, research, research. That is why in a business plan, the biggest first thing is the background and history of why this business should exist. But you also need to research things such as if you're, what are the legal laws of the state, or the legal laws that you're impacted by the different entities like the State Board of Pharmacy. What are the different legal laws in your local entity? The other thing you need to do is come up with your business name, and you want to ensure your business name that it is unique and not replicable from other businesses. You need to obtain appropriate licenses for your business, both federal, state, and local. Possibly a seller's permit, a federal tax ID, an occupancy license. You need to obtain insurance, both, for theft, fire, and liability. And you need to decide on a business structure. And a business structure is very important because it'll impact the way you are taxed, both on the federal and the state level. And then you also need to have some type of financial software, a good CPA to help get you set up, because not only will you be paying yourself, but you'll be paying other employees, and then you are responsible for not just things such as sales tax, but self-employment taxes. So let's think about ensuring your business name. What is a name? It creates the image of your company. So when you're trying to pick a name, make sure the name fits your business. Make sure the company name is easy to pronounce, spell, and remember. If you can, does your business name look good in a .com? A lot of times people have great businesses, but they don't make a great, catchy remembrance website. Make sure your name allows you for the growth of your business, that it just doesn't pigeonhole you into one thing. Because sometimes businesses end up changing their name, hence CVS Health versus CVS Pharmacy. Research the names to make sure they are available. Is your business local? Is your own name part of your business? Is it part of your town? Do you want a logo to be an integral part of your business? And if you do develop this logo, is it something you're going to love for at least the next 5 to 10 years? Yes, people recreate logos, but once you get into the marketing, creating your website, your different pieces that you might have for the marketing, your signage, that it's very hard to go back and can be expensive if you decide to change your logo. Do you plan to have a website? And if you're going to have a website, you're going to need a domain name. So you need to not only ensure your business name, but also your website domain name. You actually can do that now if you want to, at least the website domain name. There's numerous companies out there that allow you to research if your domain name idea exists, and it's fairly cheap. I don't have the businesses in hand, but I've had several different business ideas, and I have about 2 or 3 that I've not done anything with them, but I actually pay about $20 a year just to keep that domain name. If it's a corporation that you're going to develop, it is insured when you're a corporate. You need to also file with the county clerk your name. And usually what you do to insure your business name, you have to publish your fictitious name. To operate within the law, to apply for a business license or a permit in the city or county, you need to have a business name. So it's the proof to the IRS that you are in business. You also need to probably acquire in your area a seller's permit. This is required if you purchase items for resale or provide a taxable service. I know that prescription drugs here in the state of Pennsylvania are not taxable, but when you get into consulting type of services, those can be taxable. As I said before, here the Board of Pharmacy currently do not look at if you're not dispensing, you're not practicing pharmacy, so you may not need a pharmacy license unless you're providing prescriptions. However, if you're going to other states, I encourage you to research what that is. But if you are going to be a traditional pharmacy, you will have to file with the State Board of Pharmacy to get the license. Also, if you're dispensing, you'll have to file with the DEA to get a DEA license. If you're looking to do clinical services, you may have to file a collaborative practice agreement or obtain additional licensing for yourself for immunization and develop a collaborative practice for immunization. You need to think about obtaining insurance. Depending upon the nature and the complexity of your pharmacy business, you may need a variety type of insurance policies to protect you, your assets, and your customers, from general liability to professional liability to fire to workman's compensation to product liability to health, business, property, and disability. And one of the things that I encourage you to do when you are looking at all these is just don't go out to one vendor and buy them all. Price them out. Have people bid on your insurance and find what is the best thing. Obviously, if you're going to be in a local area, small town, it is probably professional courtesy to bid it out to the local businesses in your community. It's a great way to start networking and building, but please make sure that you do spread that out. Some experts suggest that before you buy these, you actually go to certain companies that sell these and tell them, I'm not going to buy any of my insurance from you, but I'm going to pay you to give me your honest, non-biased opinion of what type of insurance I should purchase. The next thing you need to do, and this is where a good lawyer and a CPA gets involved, is what type of business structure do you want? Now, I am not a lawyer or a CPA, so I'm not the sole expert at this, but I'm going to review the 3 basic structures that you see most traditional pharmacy type businesses, either a sole proprietor, a partnership, or a corporation. A sole proprietorship, it's the easiest and least expensive. You're the sole owner of the profits and losses. You're in total control, and it's less reporting. And you are taxed as an individual. And so actually you will, if you use a CPA to file your taxes, will submit your business along with your personal income tax. There are advantages that, different things are business expenses, so you can deduct them depending upon the tax laws that are currently available. The disadvantages, though, of a sole proprietorship is unlimited liability. You're responsible for all the debt. So depending upon what type of business you have, a sole proprietorship might be good if you're just doing some side consulting and that's not your full-fledged business. But if you're getting into a business where you have liability risk where you could be sued for millions or you may owe millions, I suggest that this would not be the right route. Sole proprietorships also have the less availability for capital because although loans will still be based in any type of business structure on your individual financial strength, this will definitely be that. And so you're not going to be able to definitely, borrow against the equity of your business. And later on this semester, we will talk about what you need to be able to get a loan and to negotiate with a bank. The other thing about this business structure is sometimes there's limited growth potential just because not able to raise capital. And then if something happens to you, death, illness, or injury, it endangers the business. Partnerships. 2 or more people agree to share ownership. Advantages, access to more available resources, talents, and skills. It's very important in a partnership you develop a good, sound partnership agreement because partnerships are often said are like a marriage. And unfortunately, marriages don't always last. And so having a good partnership agreement of how it will end, if it does end, is very important. Disadvantages that you do not always have unlimited liability with this. Profits must be included on each partner's individual tax return according to the percentage of interest, and you're responsible for each bad debt. So if one partner skips town, you're still responsible. Also, still may have difficulty obtaining large sums because it's still dependent upon your individual financial stability. And it's often difficult to get rid of a partnership if, you have to buy out your partner. And also, too, having a good partner that you're willing to distribute the responsibilities. Obviously, you've always heard the term silent partners can be great, but the downside of silent partners is sometimes they are silent and sometimes they are not always silent. Another option is a limited liability corporation partnership. In this type of partnership, the partners risk only their investment. They do not participate, though, in the management or control of the business. The advantage: general partners have additional capital to invest. Limited partners have limited liability equal to their investment, so they are only liable to what they invest. Sometimes, however, though, banks will actually ask each individual partner to put up some type of note in case of a fallback on a loan. And depending upon the loan that you get, this could be anywhere from $50,000 to $100,000. Allocations of income and losses may provide tax benefits as an advantage. The disadvantage: limited partners have no control over the management of the business. Partnership profits are taxed as income to the partners. So usually what happens in this type of business setup is in a limited liability corporation partnership, you usually have a managing partner, which you kind of, elect to oversee the day-to-day operations. You can have your own internal board and bylaws, but you have to kind of still follow the rules of what the tax law says. So you can get around this, but at the same time, depending upon how many general partners you have, this can be okay, but it can be bewildering if you get way too many partners. Corporations. Corporations is the one that gives you the least, it gives you the less risk, but it's the most expensive and it's most highly regulated. It's a distinct legal entity separate from the individuals who own it. It owns its own assets and assumes debt separate from the owners. The downside is you can be taxed twice. So what does this mean? That I may get paid income from, on my individual salary. I may receive dividends from my percentage ownership for the corporation, but I also may have to contribute what taxes need to be paid from the income that is generated from the corporation, especially in the early days if the corporation shows profit on paper but not in cash flow. The advantages of ownership is readily transferable. There's increased opportunities for growth and fundraising, especially if you get shareholders, and authority can be delegated. The disadvantage is that this is extensively regulated, and depending upon what the atmosphere politically is, can be highly taxed. You have to have stockholders meetings must be held, and high costs of forming and maintaining a corporation, and that double tax. There are times where corporations may be necessary, but unless your company is ready to go public or grow large, most fall into, the limited liability corporations. Probably the one, though, that some do think about is what's called an S Corp, a C Corp. A small business, what an S corporation allows small businesses to have its incomes taxed to the shareholders as if the corporation were a partnership. The specific conditions is there's a limited number of shareholders, only one class of stock is allowed, and a specific portion of the corporation receipts must be derived from active business rather than passive investments. And so once again, unless you already had studied different legal structures, are a lawyer as one of your other professional, degrees, please do not sell yourself short, but find a good lawyer and a good CPA to help you through this process. Another option is the limited liability company, an LLC. This is a business legal structure that allows owners the protection from personal liability that is provided to the corporate structure and the pass-through taxation of a partnership. So the advantages of an LLC: partners have complete management and control of the business. If greater than 15 to 20 partners, it's better to form a corporation, though. You get better tax advantages and liability. LLC works well with professional and service businesses. It works well for startup companies, and they can deduct the losses. Disadvantages: LLCs with more than 20 partners have to hire a manager. Also, states require LLC to file an articles of organization, so you have to have bylaws. You can also be an independent contractor, so you can be a consultant, often choose this structure. Like vendors, except they perform intangible services. The key thing this is the employer independent contractor is the independent of the company specifies only the desired results of the project, and the company does not have the right to direct the person with respect to when, where, and how the project is to be performed. So you cannot be a contractor where the person you're contracting with tells you what your hours are. Having a contract is important because it specifies the independence in the eyes of the IRS. So, we've talked about starting your own business. Some of the money that you're going to first set out is insuring your business name, insuring your website domain, getting key licenses, hiring a lawyer, hiring a CPA, maybe hiring consultants to advise you on what type of insurances should you get for your business. So save some money down the road. Think about, what can I do? Granted, you're not going to save all the money, but a couple things to do is keep your finances in check. When you graduate, don't go out and buy the most expensive car. Don't buy the most expensive house. If you want to have your own business, what are the things you're willing to sacrifice so you can save money down the road? What is the things that you hope to do? If you're going to buy a house in the time period between now and you start your own business, I suggest that you buy versus rent. Buying a house will allow you, even if it's a small house or condo, will allow you to develop equity and also a credit rating. But as you save the money and you're willing to start your own business, seek accountants, lawyers, and other professionals for business advice, because know what you know. The other thing is, in your developing your business, you're going to develop an organizational structure. You're going to develop names and positions, duties and responsibilities. Granted, if you're the only one owning this business, some of these will all fall on you initially. But if you have partners, who's going to be in charge of what? And regardless if the law says, you have to have an articles of organization, you should have some type of bylaws set up for your business of how you want it to operate. So that is an overview of what it takes to start your own business initially. And we're going to start getting into the weeds, but the next step we're going to do in the coming week is start looking and exploring what is your niches, what are your ideas of your own pharmacy business. So I want to end this talk with sharing with you some entrepreneurs in pharmacy profile. The first one is Mickey Finnan. Mickey Finnan is the founder of Medication Advisor PLLC. Mickey Finnan, in 2011, from the American Society of Consultant Pharmacists, was awarded a grant to establish a fee-for-service component of a senior care pharmacy practice in their community. Mickey Finnan founded the business Medication Advisors, and its business was a center on forming relationships with 3 distinct geriatric markets. It focused on retirement and independent living communities. It focused on geriatric care managers and private pay patients. And how it first developed, it started by going to these communities and giving presentations on medications, diseases to develop relationships. So initially, this business, to get it off the ground, found who was going to be their customer. Their customer were going to be people that live in these different type of senior living. It's going to also rely on geriatric care managers who help patients find different places to live, help patients pick different type of Medicare D plans or Medicare insurance plans, and also seeking out private pay patients who are having difficulties, may be able to afford their medications, or what type of Medicare D services they should pick. So develop the marketing of this. This person went out and gave talks showing how medications can affect the disease and pretty much advertising their expertise. Their marketing philosophy was this: medications can lead to hospitalizations and increased needs of level care. So they felt that this was a good marketing tool to target administrators who run these independent living communities, because if patients decompensate, they're not going to be able to stay in these independent living, and they're going to have to go to skilled nursing. So that is why they picked to market to these people, because there was a need that they may want to pay for these services for their customers living in these communities. Their business plan also concentrated on geriatric case managers, who are health and human service specialists who assist family members as well as home health. They help with referrals for private pay customers. So developing for these agencies to have, and so what they did was they developed for these agencies to have an MTM review for all new patients as a selling service, as a way of keeping their patients healthier as well as cost savings. So Mickey Finn saw that Medication Advisors was a niche. This was the beginning in the early days of MTM, but felt there is a need for people wanting to pay for expert advice of what to do with their medications. Mickey Finn also went out and established the name of the company, ensured the business name, ensured the website, and then also developed their own marketing plan. Was very simple: selling themselves. And today this company is still a thriving company developing those services. Another business that I've been personally involved in over the last couple of years is a company that was first known as CreativePharmacist.com and is currently known as Strand. Strand is a company that offers clinical solutions to community pharmacies and to pharmacy networks wanting to do enhanced pharmacy services. Strand actually first developed as just an educational company that taught pharmacists how to do diabetes education, get into asthma management, how to contract with physicians. But Strand also saw that there was need that was missing in this education process. There was not a good documentation system out there for pharmacists to use, and also a documentation system that may in the future interface with other healthcare entities. And so creative pharmacists actually developed their own documentation software. This company was founded by two pharmacists, David Pope and Dan Lawson. And they both, lived in communities, actually based in Georgia. Both worked in independent community pharmacies, but felt that there was a need that pharmacists were going to want to deliver these type of services to improve patient outcomes. And now they have gone national and able to sell their service not just to individual pharmacies, but to a lot of these pharmacy care networks across the country. So once again, just like the medication advisors, this two entrepreneurs saw a need from what they saw just out in their community and had a belief to that. So they first insured their name, which was creativepharmacist.com, and why they just recently changed their name, which sometimes can be awful risky, but they changed their name to be a reflection of what they now are. And they are a clinical documentation software company that also provides education. So you do have opportunities to create what your idea is. But what I want you to do in the next week, and this is your reflective assignment, is the following. I want you to identify a niche pharmacy market idea, something that you've been thinking about. Maybe some of you, as you were writing your first reflection paper, were doing that. How do you think this either add-on to a current community pharmacy, or maybe it's its own business, will revolutionize the current pharmacy practice? Who do you think your market is? Who do you think your customer is? And what do you think you need to do to create your market to this customer? This just has to be a one-page paper in describing your niche. I hope that this helped stimulate some ideas, open some doors to you of what you're going to need to do to initially start your own pharmacy business. And in the weeks to come, we will continue to add on to everything that we learn. Thank you very much, and I look forward to talking to you. And please look for my email very shortly on how to sign up for the GoTo meeting. Take care.